Right. Hello, and thank you all for tuning into Gail Scott Key's Entertainment Now with my co-host Kristina Millsaps, live on YouTube. Wow, it's been a while since I've done live shows, and happy that you chose to check us out, and hope that tonight's special edition will be one that inspires and encourages you. Now, if you're a fan of the show, you know that Kristina and I normally interview some of your favorite stars. Well, we do have a couple of stars here, but of a different realm. This evening is going to be very different. Wouldn't you agree, Kristina?
Yes. I mean, first of all, it's exciting because we're live right now, and we have two amazing special guests. But I was so excited in talking to you a little bit before the show to find out that today is a huge milestone for you, Gail. And I think it's important to share with all of us the milestone as it pertains to this special subject that we're talking about tonight. So what is your big announcement?
Yeah, so thank you, Kristina. So I have been really, really diligent about this, changing my life and changing how I am going to now, I guess, move in further into my life with weight loss. And so I stepped on the scale today and I've lost 40 pounds since June 1st.
40. That is a lot of weight. So congratulations, because I mean, this has been incredible, an incredible journey. I cannot wait to hear all about this and talk to our special guest.
Absolutely, absolutely. And, you know, we are excited. And as you guys know, if you're following the show and you now are joining over to the live shot, this is your first time seeing me since June 1st in now with my 40 pounds being lighter. And I have, since my journey, this is personal. It's a personal update on my bariatric surgery, but we'll also be putting some questions to those of you tuning in, and you can let us know who you are, where you are, so we can celebrate that with you. And we also want to remind you, if you listen to the show back towards the end of May, we have two special guests. They are my superstars. So back in May, I introduced you to bariatric surgeon, Dr. Rob Catania, who heads a team over at Southern New Hampshire Weight Loss Medical Center in Nashua, New Hampshire. Now, part of that amazing team is the beautiful woman sitting up over Kristina, and that is Megan DeSantis. Megan DeSantis is the surgical assistant to Dr. Rob Catania, who is a handsome gentleman down and below. We had him on the show and we had to have him back, and we definitely had to have Megan join him because my journey has been one that has been extraordinary. And because of these two extraordinary people, I am indebted. I am truly grateful. And I am so excited to have you both here. So Dr. Catania and Megan, thank you so much for joining Kristina and I live. Woo! This is awesome.
Welcome.
Thank you very much. Happy to be here.
Oh, we are so grateful. As you both know, this has been a journey that I never thought I was going to take. I had always thought about it, but I'm here and I am grateful. And Dr. Catania, we're going to kick it off with you if you don't mind, because when it was in your profession that you had seen the impact of how bariatric surgery could change the lives of those struggling with obesity, when did you notice that need and the call for your expertise, if you will?
Sure. Well, it was 2007, so goes back quite a way. And I honestly, bariatric surgery was part of my training for advanced, minimally invasive surgery, and that was what I was really interested in at the time, was just minimally invasive surgery. It was still kind of new. It wasn't really commonly practiced, and it really had a lot of benefits for patients. So I started doing bariatric surgery as part of the minimally invasive surgery. And I very quickly realized that the changes that patients were going through were really, they were life-changing. And people would come into the office unable to get out of a chair sometimes, with very poorly controlled diabetes, very bad high blood pressure. And within 6 months of surgery, they'd be walking all over the place. They'd be completely independent again. Their diabetes would be under control or it would be gone. Their other medical problems like high blood pressure would be better. And it was amazing to me how much impact 2 hours of my time could have on someone's life, and really how much benefit we could convey with just really a very little surgery. Really, and I know you keep giving all the credit to Megan and I, and we're happy to take it. But honestly, the hard work is being done by you and by the other patients who go through surgery, who make that realization that, you know, a change in their life is gonna be better and beneficial. And then they put in the hard work to turn, you know, our little bit of effort into a great success. So you're our superstars.
Ah, bless your heart. Thank you. Thank you. I've been a walking fool. I got to tell you, I got my new shoes. I've been walking, and the geese even see me all the time. They're like, "Hey, we just saw you." But what is the different types of bariatric surgery that is performed and offered? Because that's pretty relevant for when people are looking at this, because there's a big bariatric community, and I'm finding out some are saying maybe I should go with the sleeve, or maybe I should get the gastric bypass surgery. Would you mind, Dr. Catania, breaking down the differences in what they produce?
Sure. No. So the most commonly done surgeries, you just mentioned the sleeve gastrectomy and the gastric bypass. With a sleeve gastrectomy, which is currently the most commonly done operation, about 70% of patients choose to have it. We remove about 70% of the stomach. So you're left with a much smaller stomach. The part of the stomach that is removed is the part that stores extra food as we're eating and then process it later. So essentially what we're doing is we're turning your stomach from something about the size of a football to something that's closer to the size of maybe a pool ball or a, you know, large apple or orange. And so the amount of food that you can eat decreases. The rate at which the stomach empties changes, and so the body responds with a lot of different hormonal changes that make people feel less hungry. They feel more satisfied more quickly. And if you couple that with a good diet and exercise like you're mentioning, people can lose about 60% of their excess body weight. So quite effective surgery.
Very interesting.
The gastric bypass, on the other hand, is an operation where we divide the stomach into two pieces. In this case, there's a small top piece of the stomach that's still attached to the food stream, and a larger bottom piece of the stomach that no longer sees food. Now, to get the food into your intestines, we bring up a piece of your small intestine, connect that to this little pouch, and then food bypasses most of the stomach and most of the beginning part of the small intestine. This again limits the amount of food you can eat, but probably more importantly, makes even bigger hormonal changes in the hormones that your intestines produce that then go back to feed back into your brain. And that changes things like the way your body metabolizes glucose and uses insulin. It changes your hunger. It changes, for a lot of people, their sense of smell and taste. They smell things much more acutely. They taste things much more intensely. And again, very small meals are satisfying, and people are able to make healthy food choices. And in that case, typically will lose about 70% of their excess body weight.
Now, does it count that that type of surgery can also improve with your singing? Because I can hold a note a lot longer than I could before. Just saying. Just saying.
Yeah.
Wait,
Yeah,
are you a singer, Gail?
No, I just play one on TV.
Or maybe in the shower. Yeah.
So, but to run with your point for a second, as you lose weight, you know, your lungs have more capacity. You can take in more breath, and you can actually sing longer. We have a patient who is actually a Grammy-nominated singer, and she says, and she's been singing her whole life, since surgery, she is able to perform much better. So it really does have a big impact, even for a professional singer.
So I could be a Grammy nominated after this.
You could be.
Dan's looking at me saying no. All right. Well,
Grammy nominated, and also there's all this walking / maybe running, and like, you know, more news maybe to come, Gail, right, on this kind of front.
You never know. You never know. Full of surprises over here. Yes.
Yes, we just never know. Well, that's really fascinating. To explain the difference between the two surgeries, because they sound very different, but how it's affecting the brain, stomachs, you know, gut hormonal connection. That's really, when you think about it in terms of this context, that's really fascinating. Dr. Catania, what is the stigma that's usually associated with this kind of surgery, and how, like, what should the perception and the perception really be with this kind of surgery?
I think that's a great question, Kristina, and thanks for asking it, because I think there is a lot of stigma, and I hear this from not only patients, but people who are not willing to become patients. They say all of their friends or their family tell them they're taking the easy way out. And I will tell you that there is nothing easy about weight loss surgery. It's a big decision to make. It's obviously you're choosing to undergo a surgery. But surgery in itself is not the solution to obesity. Really, what you need to do is add the lifestyle changes that Gail's been talking about, making healthier food choices, being more physically active, being more careful about when and how you eat. And so when people, tell me that they don't want to have the surgery because everybody tells them that it's just the easy way out and they should just earn it the old-fashioned way, what I tell them is, so that's completely wrong. Right? This is a disease that we're treating. Obesity is a disease. You wouldn't treat high blood pressure by wishful thinking, right? You would take a blood pressure medication. Same thing with obesity. You should treat it medically because it's a medical disease. And when you couple the surgery with the healthy lifestyle changes, you see a tremendous benefit. Lots of people that I've seen over the years will make good food choices, they will exercise regularly, and they will still be obese. And that's really very tough on a lot of people's self-esteem, because they're doing everything that they're told to do, and yet they're being berated and saying, oh, you just need to eat less, or you just need to work harder. And it's just not true.
And that is the biggest stigma that you hit on the head, because I was being very active. I even have a stepper, because even when I'm in my 20s, I was exercising, and which, it took me years. I'm 53. So that,
aren't you 25?
Yeah, that's right. But of course, this decision led me to your wonderful assistant, Megan DeSantis. And when I met Megan, I remember when they called my name, I went into the back and I met with her. And Megan, I sing your praises like I do with Dr. Catania. I'm not going to mince words. You two are incredible. And I love the thoroughness, because from the beginning, you made it clear, this is going to be a partnership. This is what we're going to do on this side, but this is what you need to do on your side. And together it's going to be successful. And with that, your desire to be part of such a life-changing practice with Dr. Catania in bariatric surgery, how long have you been helping to change patients' lives in the position that you hold?
That's a great question. It was definitely an evolution for me. I started working as a physician assistant in surgery in 2003. I was a little bit younger at the time. The practice I joined was in general surgery, so gallbladders and appendixes, but also vascular surgery. And then a few years into that practice, we started doing less invasive surgery, so laparoscopy. A surgeon that joined our practice was performing some weight loss surgeries. And at the time, PAs in our practice didn't help with those, but we did have the opportunity to care for those patients in the hospital. And I found it very fascinating and terrifying all at the same time, because here we are operating on someone that doesn't have an obvious infection. They're not septic, they're not sick, they're not bleeding, but here we are performing this pretty major surgery on these patients. And that surgeon was very talented. He moved on and now is an instructing physician at Leahy. And then a few years down the road, Dr. Catania joined the practice. And for me, that was a real game changer, because then I had the opportunity not just to help care for the patients, but to learn how to perform the surgery. And to be perfectly honest, from day one, I've been a surgery person. I love it. It's challenging and terrifying and fascinating. And so when I started to learn a little bit more about the surgeries, I understood more. In the beginning, it was just a fun procedure, something new to learn. But then when you really connect with the patient, you get to know their surgery stories, their life stories, and you get to learn about their life challenges. Then you get to see them after, and you watch their lives change. That's why we do surgery. It's just a slightly different time frame. So we were working together for several years. And then when he made the change to move to Southern New Hampshire, I was looking around for something different. I wanted to move from more of an administrative role to a real clinical, bedside direct patient care. And they had an opportunity, and boy, did I jump on it. So to be honest, I banged down the door till they gave me a job. And
Yes.
I have no regrets. It has been challenging and exhilarating and terrifying. And I'm very proud of what we do and very proud of who we are.
I am very proud of both of you and the dedication that you both have, because it's genuine. There are some who will just pass you along as if you're on a conveyor belt, and that was not at all what happens. And for those who are tuning in, of course, and thank you for doing so, we are live, Gail Scott Key's Entertainment Now with Kristina Millsaps. We have Dr. Rob Catania, who is back joining us, who is the surgical director who has been launching for the Weight Loss Center Management in Southern New Hampshire. And we have Megan DeSantis, who is the PA, who I've intercepted and from the start, just when I tell you, guide you, because the bariatric community that you are out there, it's there's a lot. There's everybody holding together on this and getting advice. And so we want to pose this out to you, to our viewing audience, to the discussion, as we want to hear from you as well. So if you're in the chat, if you have bariatric surgery, what was a turning point in your life that made you want to have such a procedure? I can tell you for myself, it was migraine attacks. It was also an eroded hiatal hernia. And oh yeah, did I tell you I haven't had a migraine attack since I've had the surgery? I'm not kidding. That's how incredible this surgery has been and impactful it's been on my life. So for you, if that's the same, we would love to hear from you. Again, tell us who you are, where you're from. We want to make sure that we connect those dots. And so we're going to put that question in the chat. So if you've had bariatric surgery, please tell us the turning point that it was for you. And I know Kristina has some more questions for you, Megan.
Yes, Megan, this is, our favorite part is just asking the questions and learning all the answers and really learning about topics like this, because as Gail has mentioned, with the bariatric community, like she has just met so many people, and she talks about how there's so much support and what an integral role that you have played as intercepting in the process as she came in contact with you, and how that really brought about a whole nother sense of learning about the process and the journey. So when patients are looking to get the procedure and they're intercepted and get to meet with you and talk to you, and you really start breaking things down and create that personal relationship as another added level, besides Dr. Catania, in their initial introduction and process. Can you tell us and explain how you help patients understand what they should expect from either opting for a gastric bypass or the sleeve, and what process they must undergo from there to be considered for the surgery? Because of course, there's a lot of guidelines with that too, right?
Absolutely. Our goal, of course, is safety first. There are very few operations where you make a conscious decision to go through that. And so I sort of look at it as an opportunity to take time and do it right. Your first interview with us is just that. It's an interview. We want to talk about your weight history, your life experiences, if there was a particular illness or major life event where you noticed that you gained more weight than you would expect to. For many people, it can be a traumatic event. It can be a separation, a divorce, job changes, new medications. For many people, COVID really resulted in a lot of lifestyle changes, increased stressors, and weight gain. So in our first visit, it really is an in-depth talk about your life history as it pertains to your life, to stress, and to your weight. We want to learn about your habits. What are your likes and your dislikes? A lot of times, we talk to people about healthy lifestyle habits. Well, that means something different for everyone. And so in that first visit, I'm impressed by the courage that patients have to be so honest with what their challenges are. When we talk about feeling out of control with eating, stress eating out of emotion, those are things that we talk about in the first visit. We talk about medical history. If you've had any surgeries, medications that you take, health concerns. We talk about goals. For many people, there's a number that they'd like to see on the scale, but we also like to really pay attention to what we call non-scale victories. How has your obesity affected your life? Does it stop you from doing things that you want to do? And when we talk about setting goals for patients, setting realistic goals, but also understanding that they might have different goals for themselves than we might have for them. So that first visit has a lot to do with that. There's a physical exam, nothing really invasive, but really looking at our patients and looking for any changes in their body that put them at increased risk for surgery, but also looking for diseases that perhaps we call comorbidities that travel with obesity that perhaps haven't been recognized in that patient. After we finish the physical exam, we talk to them about the next steps. First of all, we decide, are you a candidate? And unfortunately, insurance has a big part to do with that now, although we're getting pretty good at working with that and around that when we need to. We talk to the patients about next steps, and it is fairly protocolized. Notice I haven't said anything about choosing a surgery yet. Quite often, patients to just help them don't pick their procedure until they get closer to the surgery date. We have a very stepwise approach. Education is a huge part of it. So learning about
For some reason, I think we were cutting out. I think we got you cutting out.
I think we maybe lost audio with Megan.
Do we have audio back with Megan? I am so sorry.
I can jump in for her for a second while hopefully her internet
Sure.
catches back up.
Okay.
So I think she was telling you about how the process works in terms of how we evaluate patients.
wonderful nutrition team. Our patients will see them several times, but in focusing on health.
That's okay. She wanted to. She's not only just a physician. She can help and do that little mime.
Yes, it's all catching up at one time. This is why we go.
Right.
This is, the challenges of being live and how we
Yes.
just roll with it.
So we apologize. So yes, go ahead. I'm sorry.
Are you back, Meg? Say hello and see if
Hello, can you hear me?
Yes. Now
Yes,
we can.
now we
Yes.
Okay.
They're such a great team. See, they're showing us how to host and co-host. That was
They
awesome.
are. They have each other's backs. This is what the team is all about.
Well, he
Yes.
knows if I pass out or stop talking, he just steps in and I'm supposed to do the same.
I'm glad it wasn't during surgery that you passed out. So yes, keep going.
No, not as of yet. I think I was talking about nutrition. Yeah, so we have you focus on protein-rich foods, starting to track, which is really important. Some patients will use a notebook or use an application on their phone. We have one in particular we recommend. Tracking is really important for learning about eating habits. It's about practicing mindfulness and making healthy food choices, but it's also very important after surgery as you're starting to introduce foods again to ensure that you're fueling your body. So we sort of build that in early into the process. We want you to work towards an activity goal of 30 minutes a day. Now we say activity rather than exercise because for a lot of people, exercise is a lot like the word vaccine. So for me, it's more about moving your body and keeping things moving, getting your heart rate up, finding what it is that you like. If you don't like it lifelong, it's just not worth introducing. A really careful risk assessment. We want to make sure when you go to sleep the day of your surgery, you're as safe as you can be, you're as healthy as we can make you. And Dr. Catania refers to that as prehabilitation. We want to make sure your heart, your lungs, your kidneys, everything's on the up and up so that we are ready to go and you are ready to go. We assess behavioral health, and really, we're not looking to find something that is wrong with you. Many patients have anxiety, depression, bipolar disorder, and that's just human nature. What we're looking to do is to make sure that you are in a safe and stable place. So a behavioral health consult with a trained professional is a key part of the process. We also have regular support groups, and we like to introduce our patients to participate with that because I haven't gone through surgery, and who better to learn from than someone's on the other side of that experience. We do a bit of lab testing. After the surgery, people are at risk for certain nutrient deficiencies, and we want to track down and treat any of those in advance. And also we want to look and make sure that your body is healthy, your heart, your lungs, your kidneys. All of these are tests that we can easily do in advance to make sure that when you go to sleep that day, you are as ready and as safe and as prepared we can make you. Mm-hmm.
You absolutely go out of your way for that. And I have to attest to the exercising, which I do, walking every day. I can't tell you how many people I have met. And now, as you said, in the bariatric community, it is true. I see everybody just cheering everybody on, some announcing I'm getting ready to have my surgery, whatever it may be, the sleeve or the gastric bypass. And, it's just everybody just jumping in and wrapping arms and saying, you are going to be fine. And I actually, yes, put both your pictures up there. The picture that we had, I had Dr. Dr. Catania and Megan behind me and the nurses and stuff. And we had this nice photo op right before I was about to get shipped off. And Dan was just like, it's only you. Of course you would do that. Of course you would. Of course I would. Of course I would. So Megan, talking about what I would do. Okay, yeah, it's me. When I went in to meet you, this is one thing that I thought I'd be walking out with an appointment for the surgery that day. I was like, yes, but no, there's an education piece. So please, you did such a wonderful job when you intercepted me. We have to make sure. I want to share with everyone what the process is, because it's so important, because you and Dr. Catania play a key role in the success of the surgeries you perform. We have to, as the patients, have a key role of the participation of what we do and follow to make sure that we have success as well. Would you like to share a little bit more on that?
Sure. A lot of different programs will target this in different ways. Our program has an online educational process called NutriHealth. There are some programs that do it in a classroom setting, but for a lot of our patients, that's difficult with families and lifetime commitments. This takes about 10 to 12 hours. I've done it. I will tell you, I did not get a score of 100, but I did my best. There's a little bit of learning about emotional eating, about the surgery process itself, about your life thereafter, a little bit of nutritional education, and it's really geared towards the required and recommended education by those organizations that oversee the safety and the quality of our practices. And so our patients, when they finish it, get a certificate, and it takes a total of, I would say, it took me about 10 hours to do. Patients get really upset if they don't get 100. I usually tell them,
homework. Yes. My briefcase.
And we see you very frequently as you prepare, as you know, for surgery. And each time we talk about those pillars of the treatment, how are you doing with activity? Are there any challenges you're facing with your eating habits? Are there any issues going on in your personal life with your family? Do you have good support? And then we check in, most importantly, with the education and the preparation. Absolutely. It's a good conversation maker, because we can't go home with you. I would if you let me, but we can't.
I had room for you guys, but I was like, no, all right.
Yep.
But you both are amazing. And I know that we did ask in the chat. Again, we just want to reiterate and thanks so much for Southern Hampshire Medical Weight Loss Center. We have Dr. Rob Catania joining us back, and Megan DeSantis, who's patient support and surgical assistant. And they both have been the reason why I'm sitting in front of you so elated and so much, a little bit smaller. How about that? Yeah. It's a good thing.
I think it's a whole lot smaller.
You're so sweet. You're so sweet.
Yes, and more to come. Well, I just have to circle back around to that, Gail. I want to know, have you gone shopping yet? We can talk about this later, because losing 40 pounds, I know you're still like doing more, but there's got to be maybe like milestone, this gets this many outfits, this milestone gets another outfit.
Now see Firestarter, because Dan's going to be at the door with the credit card going, what did Dr. Catania say? No shop for you just wait.
Yes. Well, I don't know. Well, holidays around the corner, there's always something coming up, and with Labor Day's coming up.
Try to tell the man, but he's like,
well, we're so excited to be live tonight. And Gail did throw out there asking anyone about the bariatric surgery, if they've had any experience. And we have had somebody comment here, so I'm going to try to read it without my glasses. One of our viewers has said, I haven't had the surgery personally, but I have an aunt who suffered from migraines, chronic pain, and other symptoms, who got the surgery years ago and has been doing much better since. So that is super encouraging, much to like your testimony, Gail. That sounds a lot like what you've been experiencing.
Absolutely. I am telling you all who are watching and listening to me, when Dr. Catania and Megan said that when I released the situation of not only for my migraines and said it is going to change, again, the education supports. You have low sodium, low sugar, no added sugars. I used to drink coffee. I don't even drink coffee anymore. I remember in the hospital, I could have decaf coffee. I didn't desire it. So this, it really changes my life. And for me, walking, they're the heroes. I can't say it enough. They're humble. They will be like, I say, yes, Yes, you are. And it has been such an amazing, amazing journey for me. Now, I wanted to make sure that I was talking about this, the stigma that we wanted to, and we want to open up to Dr. Catania and Megan, because there is some stigma that is keeping some people from having this that need it. And what I love about both of you is you're very caring. It's like, I remember a long time ago, Richard Simmons said on a plane, I will never talk to someone about their weight until they come to me first. And that's how you've intercepted us. And with the stigma, some people think you're supposed to be, a certain weight, and that's the only ones who can qualify for it. But that's not true. I'd love to hear from both of you, the different versions of what that stigma means and how we can educate and help some who are watching right now. Dr. Catania, would you like to kick it off?
Sure. Yeah, I think there's a lot of different misconceptions about who can and cannot have surgery and who should and should not have surgery. There are some guidelines that we follow, an initial set of guidelines that were put out back in the early 1990s, and those were related to body mass index and then also to medical diseases that are associated or frequently tracked with obesity. So those are things like diabetes, hypertension, obstructive sleep apnea. A new set of guidelines has come out in 2022, which actually changes some of those numbers a little bit, again, based on the BMI, and adds some other diseases that are associated with obesity that also should qualify people for surgery. And so, but I think the thing people need to realize is you don't have to have surgery if it's something that you're afraid of, but if you qualify for surgery, if you meet those criteria, what that means is, after studying tens of thousands of patients, we've been able to show that patients who have those situations, maybe a body mass index of 35 and high blood pressure or diabetes, that they do better after surgery. And so I think part of it is and even coming in to see us, when people come in to see Meg and I, just like you said, you thought you were going to walk in and get a date for surgery. Generally, what happens is you walk in and we learn about you and you learn about us. And then we meet again and we learn a little bit more about you and you learn a little bit more about us. And we start telling you what options are available to you. And you have to be comfortable with the idea of surgery. Your family has to be comfortable with the idea of surgery. And if that means, meeting with the family as well as the patient, that's something that we like to do. I think probably the hardest misconception that we have to deal with are the patients who come in and say, I need to do something about my obesity, but my cousins, brothers, uncles, fathers, next door neighbor had bariatric surgery and had some horrible complication. And so I'm not going to do it. And I think you really need to be careful when you think about that, because complications happen. And when they happen, we deal with them and we get you past it. Yeah. And Gail might have some experience with that she wants to share it later. But what happened to someone else it shouldn't impact what you decide to do. Really, you need to make this decision on a personal level. If you feel like your weight is impeding your ability to enjoy life and live the life that you want to live, then you should think about having weight loss surgery if you meet those criteria. And so I think really from my perspective, that's the most important thing is patients who come in with an open mind, who are willing to learn about the science behind weight loss surgery. And if they qualify for that surgery, and they feel comfortable making that decision, then we go ahead. And if they qualify, but they're not comfortable, then we don't just say, well, good luck, goodbye. What we say is, well, how about you work with us on lifestyle changes? How about you work with us with medication? And we'll see how your comfort level changes over time.
Absolutely. And I mean, you hit it on the head. And even when you made it clear with us, things happen. And when I was healing, and it was the scar tissue that had twisted the bowel, immediately, there was no hesitation. I'm telling you, Dr. Catania and Megan were there, and the whole team and the nurses. And let me tell you something, That means everything, because if you're going to be scared, then listen to me. If anything, God forbid, was going to happen, isn't it nice to know you have a caring professional staff that will step in quickly, as mine did? That's why I hold them up with such regard. There was no playing around. There was no second guessing. They went in, and people are still like, what, you're able to do this, you're able to do that. That's because of them. They're the blessing. So right on, Dr. Catania. And Megan, your thoughts on that?
You know, I think that there are very few diseases where people feel so comfortable giving their opinion. And we talk about this in our support groups with patients, and it's not just family members, but it can be healthcare providers. One of the support groups, when Dr. C was away, I said, write down for me on a sheet of paper the stupidest thing a healthcare provider has ever said to you about your weight. And I was shocked by some of the things that I heard. And it's just, there's no other real disease where people say to you, boy, you know, your blood sugar looks terrible today, or, you know, I can't believe you're taking Kosar instead of Coreg for your blood pressure. It's just, if you didn't wear it on your body, I don't think people would feel that they had the right. I do think, though, that the why is the most important part of any patient's decision. I think once you make a decision, understanding why you pick it, feeling comfortable with your choice is a power. It's empowering. It gives you the confidence. If you don't know the why, then ask the questions. And then when it comes to complications, knowing your body better than anyone else, if something doesn't feel right, then you owe it to yourself and to find the confidence to pursue it. We will always believe you without question, but you have to also have that courage to say, this doesn't feel right, and to stand up to your family as well when you're making an important life decision like this.
Absolutely. And as you were talking, Megan, someone flashed up with a message saying that this is powerful information. They thank you both for sharing that, all that you are. And they said that now they're going to be thinking about it.
Yeah, you might have an influx of appointments and interceptions and interviews after this live interview. Well, you both touched on, and Gail, the possible complications. And Dr. Catania, every surgery has risks. So can you just give us a little more information on what could be some of the risks before having a surgery like either one of these that you've been talking about tonight?
Sure. Well, so there are some risks that are true for all surgeries, right? So anytime that you enter someone else's body, you could potentially cause an infection. So that's a fairly common risk, common across all different surgeries. It's a very low risk. We give people antibiotics to prevent that. We use skin cleansers. We use sterile techniques. So we have ways to kind of prevent that, but you can never make it not happen. Same thing with bleeding. Anytime you enter a person's body, there are blood vessels in the neighborhood where you're working, and one of those could get injured. And if it does, you can lose some blood. Again, something that we know a lot about, and especially in the era of minimally invasive surgery, we can see very well. So little tiny blood vessels that are, much smaller than your pinky bleed very quickly if they get cut. But we see them; they look gigantic to us on the screen. So much easier to see and avoid. So bleeding, infection, those are common for, well, I wouldn't say they're common, but they are risks for any surgery. The risks that are very specific to these operations are leaks from the areas where we cut across the intestines. So your intestines are sort of like the outside world inside your body, right? Because your intestines are full of bacteria, and they're full of acid, and they're full of compounds that help dissolve food so that it can nourish your body, right? So you don't want those things getting into your tissues because they can damage them. And so those are called leaks. And whether it's from the staples that we use to cut and separate the tissue, or from the sutures that we use to sew things back together, leaks can happen in those places. I say, we have to be 100% waterproof 100% of the time. There's no room for error. So if a leak occurs, a patient can get quite sick, right? Because we're spilling these very acidic, very caustic, and oftentimes very bacteria-laden fluids into your belly, which can make you sick, right? So that's the big risk for all of bariatric surgery is leaks. And we have the leak rate down to well under 1% at this point. There are things that can happen, like scar tissue can form. And that can happen a couple of weeks after surgery, or honestly, it can happen a couple of years after surgery. And it can cause blockages in the intestine. If that happens, we have to be able to go in and unblock those blockages. And then there are things that can happen that are completely unrelated to what I'm doing as a surgeon, but more related to how your body responds to the surgery. So things like the stress on your heart, the stress on your lungs, which can cause a heart attack or an asthma attack, or the stress on your kidneys. Now, thankfully, we're very good at monitoring you the whole time during the procedure. So we make sure that if you start looking like you're having stress, we have a response to that, whether that's fluids or medications, blood thinners. And so fortunately, we've been able to drive down the complication rate on bariatric surgery to about 2%. And so some of the most commonly done surgeries that people think of as routinely safe, like having their gallbladder out, are actually less safe than bariatric surgery, because
Yes.
we worked so hard to drive those rates down and make this as safe as we possibly can.
See, I knew this part of it was going to get to me. It's always after the surgery. I'm like, what? You never know. You're sitting there when you wake up and it's just like, wow, I wonder what it looked like. I wonder what it looked like. And I was like, oh, wow. So that's what happened in there. All right. But no, it's so incredible. And the biggest thing that I want to reiterate, in which you both reiterated to me, is walking and having the protein drinks. And Dr. Catania, I know I'm a very literal person, right? When you tell me to do something, I do it. So what happened when you were first going in on me? He was like, he did it so literally that it was like trying to get in there, and poor Dan was just like, how come that's going so long? It's because his wife just took so much protein drinks and stuff, because you have to shrink your liver because you have to get in there. So yes, I'm still taking my protein drinks. And I'm still doing everything to the T, so no one can say otherwise. I've got my vitamins, got my vitamin patch. And so that's what I want to talk about. And I want to share and put into the chat too, for those of you, for what I'm going to talk about, the food. When you go from the protein drinks, when you go from the soft and you're doing the different phases. Megan, you were making sure to tell me, you're still going to be losing weight, because I got to tell you, I saw Pat last week and I was just like, okay, now I can graduate to real food. What is this going to look like? And I'm thinking, I was so scared. I'm like, can I eat this? Can I eat that? Yeah. And I still am losing weight. So can you help me out with this so that people can understand the transitions and the phases? Both of you can talk to about that.
Sure. As you experience, the preoperative diet is very real. It's no joke, and the goal of that is to reduce your glycogen stores in the liver, making your liver smaller and making the operation safe. And I will tell you, your liver was absolutely beautiful. We know how dedicated you are to following it to a T. And it's tough, because that is a largely protein-rich, low-carbohydrate diet for the 2 weeks before, and then you really are committed to a largely liquid diet for a while after. As you remember, within 6 hours of surgery in the hospital, we had you using very small medicine cups to just start sipping on water. It was harder than you thought, wasn't it, too? Yeah.
It was. I was like, I hiccuped and it's
Yep.
good.
Yep. And after your first night, we have you on what's called phase 1, which are clear liquids, but they're sugar-free, also including things like chicken broth and Crystal Light. Sugar-free popsicles are how I bribe patients into smiling on post-op day 1, for sure.
I got a big box now. I ordered. It's in my freezer.
Absolutely. We even have patients that make their own. But in that first 24 hours, really, it is about getting your fluid in and testing and learning out your new body and what's going to go and what's going to not go. This is when patients really describe their flavors and their sensation of things being turned up. Sweet things are very sweet. Salty things are very salty. In the hospital, your goal is to slowly sip on those clear liquids or those popsicles over the course of the first 24 hours. Some patients go home that next evening and some stay for 2 nights. When you go home, it's what we call phase 2, which is protein shakes, things like protein-rich liquids, Greek yogurts, often that have to be thinned. And this is where we talk about your anatomy being a bit more like a funnel. Things have to be loose enough, soft enough, liquid enough to make their way down. And those first couple weeks for patients, I think, are really tough. It's getting those 60 grams of protein. You're sick of your protein shake, finding, and our patients are really creative,
Yes.
finding ways to get that protein and using the skills that you learned in your training to make sure that you're tracking, to make sure that you're getting adequate fluid. At your 2-week visit, we start to let you try some other foods. People are always very excited to add things with a little texture, almost like a baby. Yeah, that's right. Yeah. And then still though, really using that protein, that liquid protein as the foundation.
Yes.
At your 2 to 3 month visit, we start to add a little bit more in the way of chewable foods and textures. Again, still really leaning on that protein. And learning your body. There are some foods that people just do not tolerate after. And we say, well, don't give it up forever, set it aside and revisit it. But eventually the goal is to get to a place where your average meal is about the size of a measuring cup and takes you about 30 minutes to eat. For a lot of patients, that is one of the biggest challenges. We are all guilty of eating too fast. Life is really busy. You're eating while you're doing 15 other things at the same time. And as you said earlier, before we started the discussion today, you are still really focusing on doing that. And so that measuring cup, putting your fork down in between bites and really focusing on enjoying your food and pacing yourself.
Absolutely. And I have my timer. It went off a couple of times. So I'm just like, okay, already then. But it helps you, right? Yeah.
Can I throw one thing in
Please.
there also? So, the first few months after surgery are very difficult in terms of, making the proper food choices. And honestly, the meals are a little boring for a couple of months. But I think it's really important for people to remember that we are not taking the joy of food away from you forever, right? It doesn't mean you can never eat tasty food. In fact, the opposite is true. Really, if you want the most flavorful food you can imagine, that's perfectly fine. You can put as much spices on your food as you can imagine. You can grill it, you can bake it, you can broil it. Frying it, we don't love, but you can almost eat anything. With the exception of really concentrated sweets. Like the one thing that we do sort of take away from patients is the ice creams, the brownies, the really, really dense sweets. Yeah. But there are so many substitutes that are you don't think of it, but you can take a protein shake and turn it into an ice cream cone and you can eat that.
Everybody,
right? The fruits and vegetables can be extremely flavorful. And so I think there's no rule that says you have to eat bland, boring food after surgery. It's just that you've got to find your new happy place in terms of what your palate is looking for.
Yes.
You can really go to town and really enjoy food.
I've got to tell you, I went on the link that they have for the portal for the patients, and I printed out, I have in my drawer this big of a cookbook. It's my own cookbook from the bariatric types of recipes that you can have. And everybody who is sharing the recipes in the biggest time, especially with the hot weather, they're doing the different types of the protein mix so that you can have, an ice cream. But for myself, it's still that mind over, okay, can I have, like, I had my meal planner. So you can have tuna, you can have crackers. And my Dan is looking at me, he's like, when did you ever like tuna? And that's like, this is my thing. Excuse me. So you find out, and it's so true. The food and everything changes. But I have to say, it is so rewarding when you have an awesome team like all of you. And I want to speak about the incredible office. We have to give a shout out to, everyone over at Southern New Hampshire Weight Loss Medical Center in Nashua, because they are the ones around all of you in the center, the nucleus, if you will, of extraordinary help. Even when I go into the office, everybody just has a smile. They're ready. They're just looking, and it's just amazing. So I'd love for you both to give props also for the office and who they are, especially with Pat, because I'm going to see her again for my nutrition. She's amazing. There's just such care. You've designed this office. I can't say enough about both of you in your office. I just can't. It's just a caring staff all around. And my nurses on the east and west wing on the 3rd floor. Thank you, ladies. Thank you. All the love there. But yes, you were going to say, Dr. Catania.
So I think we've gotten very lucky, right? It's hard to find people at all to work these days. The world is a little topsy-turvy, but we have managed to find a really great staff. I think it all starts with our office manager, Cameron, right? She has been working with Meg and I for about a decade now. And we first met her when she was just a little cub right out of school. And we trained her to the point where she took over and now she tells us what to do. So I guess that's really good.
Absolutely.
But and so I think the reason why the office works so well is because she is so detail oriented. And so nothing gets dropped. We don't miss phone calls. We don't not follow up with patients. And Eve sitting at the front desk is a godsend to us. She somehow manages to check people in, check people out, answer the phone, schedule things. I mean,
I know.
she does the work of 5 people. It's amazing to me every day.
Yep.
We have Jill, who's sitting as our office nurse now, and she's got experience. She's worked at several weight loss centers over the past decade, and so she has tons of experience. If she tells you something on the phone, 99.99% of the time she's right, so just listen to her. And most of the time Megan and I do anyway. So and then, if there's ever a problem, then she gets us.
Yeah.
Our medical assistants are great. One of whom is home in the Philippines right now, so she's gone for a couple of weeks, but we should be getting her back. MG, and she's been around for a long time. Now, let's not forget we have a medical weight loss team as well. And so Ellie Chang, Dr. Chang is an endocrinologist and a weight loss specialist. We have another weight loss specialist coming on in a couple of days. Actually, it might have been tomorrow. Yeah. Dr. Melissa Skull. And then we have Trisha Keyville, who has also got years and years of experience as a nurse practitioner in weight management. And then our nutritionist, Pat and Julie. Pat, I think Pat joined our group with a lot of skepticism about 3 years ago. She comes out of diabetes education, and I think she's realized that helping people lose weight not only helps them lose weight, but it also helps make their diabetes go away, which she was really passionate about. For women who have PCOS, it makes their PCOS go away. That's another thing she was really passionate about. Meg, you want to talk about anybody else or the floor staff?
I will say that one of my jobs, in addition to the clinical role, is to serve as the bariatric surgery coordinator. And so I work with our quality partners to ensure that we are maintaining the highest standards in patient care. And all of our patients do go to one particular unit in the hospital. And I will say from day one, they have embraced their partnership with us. They are kind to our patients. They brag about our patients as being some of the most prepared and the most educated. And they ask great questions from day one. They've been very engaging. Southern New Hampshire Medical Center in particular, every email you send, someone is interested in learning about our practice. And it's from the first visit to the pre-op visit. Gail, I know you got to see some of the nurse practitioners there.
Yes.
The anesthesia team, the recovery room nurses, from the people that walk you in and walk you out. They want our patients to be comfortable, and that's really important. I think the culture is one of the most important parts of the patient experience. We are just a very small part of your experience during your hospital stay. If you've ever been on the other side of the curtain, you know how each person that walks into the room leaves a mark. And what I'm proud about Southern is that it's a good one. And what people have to say is good. And our office, they're just good people. We're all on the same mission. Everybody is an all hands on deck person. If the person in front of you drops something, you pick it up and you run with it. And I think that is what makes us special, for sure. Yeah.
You are very special. And, I know we have 5 more minutes before we close out this very special show with Dr. Catania and Meg DeSantis. And I want to leave on this note and just say personally for myself, from the times that I visited before from being sick, sickle cell trait and having the migraines and everything, there was a point where I'm like, I don't know where I'm going to see the silver lining, but I know it's going to be out there. And to be introduced to you both has changed my life in a tremendous way, because from my family, I literally had gone from anybody who knows me seeing some of my family members die in front of my face. And people are like, how can you be so happy? This is why, because not only from my faith and dear friends, but you are led down certain paths to your own personal healing. And Dr. Catania and Meg DeSantis has just changed my life tremendously. I told you both, I don't know how you can thank someone. So the best way I can do is bring you on my show and let everybody know that the props are right here. Yes, I'm doing the work, but they were the ones to inspire me. And I really want to thank you both from the bottom of my heart. You are efficient, you're professional, you are education, everything, the wisdom that you both possess. And you literally have helped me change my life. And happy wife, yes, happy husband, because he's just like, wow, you're different. You look different. We go walking together now. We really didn't before, because post-COVID sort of made me like a recluse, but now I'm a walking fool. So if you see me, you can honk. Not at me, but just honk. Anyway.
Well, I just want to say, I just feel so warm and fuzzy from all this interview, because I don't live in your area at all. I'm in Atlanta. You guys are in the Northeast. And just the way that you've really articulated and described your practice, the journey, the people involved, it in what you communicated about how important the mindfulness and the state of mind is. I mean, it doesn't sound like you could get any better. That it's like a family that you get to be a part of. That doesn't sound like it really ever ends, with the support team and the community, and then all of your staff that you've handpicked and trained. I mean, I am not a candidate for bariatric surgery, but I feel like I would want you guys to be my team if I was. Like, maybe there's something I can come up there and just maybe have lunch or something, and just, sit around and have girl time with Dr. Catania too.
Yes.
Like, it just sounds like you've got an amazing women as support staff. And I mean, Gail has been singing you guys' praises for a long time, because as she said before, she started before the surgery. There was this long process that she went through. So, I mean, I'm just excited to be in and meet you guys too, and hear all about this.
Well, when you come out
Definitely
to visit,
welcome to come up anytime. We'll host a bariatric friendly lunch for everybody. But
Okay.
I want to take 1 second just to say, like, and we really appreciate how much you appreciate us. And I do think we work hard, and I do think we do a good job, but you have a national audience out there right now listening to you. And there are bariatric centers all across the country that are doing what we're doing. I'd love to tell you we're super special and we're different than everybody else, but I don't think we are. I think people who are passionate about taking care of the disease of obesity understand that this is a disease that encompasses the mind, the body, and the soul. And you really have to treat people completely and holistically to be successful with this. And I really do think that, if you're in Cleveland right now, or if you're in California right now and you're watching the show, there's a local provider that you can find who's going to give you great care. And find that person, right? Don't go to the first weight loss person that you meet. If you don't like the person, or you don't get a good vibe, go someplace else, right? You do not want to be part of a factory. You do not want to be a number. You want to be important to the team, and you want to feel that you're important to them. And I predict if you look around in your neighborhood and you're interested in losing weight, you'll find someone who's going to be able to help you that way.
Well said, Dr. Catania, Meg DeSantis. Can't thank you both enough for spending this hour with us. And of course, if there were any of you who had put anything in the chat, we'll make sure that we share that with both of them, and they will follow up on it. But again, we want to thank you both for taking this time with us. I just, again, can't thank you for my life change. And I'm super, super excited. And I have to do my water, and I have my timer. I'm being a good girl. Look at this. All right, cheers. See, there you go. There you go. We'll lift him up as we have it. There we go. And for all of you who have joined us through this live session, I want to thank you from the bottom of my heart. Thank you for the encouragement that you personally gave to me online. And of course, we'll be bringing this show, even though it's live, we do have it recorded. We are going to make sure that it hits our Facebook and, of course, all of our social media platform. Dr. Catania and Megan DeSantis, thank you so, so much for spending this time with us. You've been amazing. Oh, my heart's right there. They're awesome. They're awesome. Any more questions that you have about your maybe change you're looking at bariatric surgery? Well, what you can do is follow us on Facebook. I'll give you all their information. And it is Southern New Hampshire, where you can go in New Hampshire for the medical center, weight loss medical center in Nashua, New Hampshire. And I will post up the street address and all of the pertinent information if you would like to get hold of Dr. Rob Catania and Megan DeSantis, and you'd like to have perhaps a consultation, they'd welcome that. I want to thank you so, so much. And on behalf of myself and my co-host, Kristina Millsaps, thank you so much.